Okay, good morning.
Good morning.
Good morning.
Good morning. This is the New Mexico Department of Health, Facilities, and Los Lunas Community Program Governing Board quarterly meeting. As you know, we're meeting today in Behavioral Health Institute, so Troy, appreciate your team with all the support they're giving us. And I think we're having a facilities meeting this afternoon. Is there some lunch, I think, too, or for some people that want?
There's lunch provided, your snacks next door, bathrooms are just down the hall to your left.
Okay, great.
Welcome.
Yeah, welcome. Thanks for having us on your campus. And if anybody wants a tour, can they get a tour if they want one?
At least 300 acres, 48 buildings. Nothing shoes out of the window.
All right.
How many cemeteries?
We have 3 cemeteries that we know of.
That you know of? Okay. Well,
Welcome to campus.
welcome to do that. And those that are staying for the facilities meeting this afternoon, which we do usually every 6 or 8 weeks, that's going to start at 1 o'clock and go to 4 o'clock. So I'll just mention, you can either go out to lunch or currently there'll be some food here too. So they can do either one. I'd like to go ahead and start with the call to order. What we normally do is go around the table and try to establish a quorum. We have some visitors here today, so after we do that, I'll have the visitors introduce themselves as well. Okay? So, as I said, I'm Brad McGrath, Chief Deputy Secretary for the Department of Health. I'm going to start here on my right.
Retta Ward, Cabinet Secretary, Department of Health.
Stephen Dorman, Chief Medical Officer, Department of Health.
Kathleen Leffel, Administrator for Bear. Kim Toronto, Facilities Fiscal Officer.
She has many hats.
Right.
Sherry Bates, Finance Director for Bear.
Michael Stanton, Deputy Director, ASD. Roy McDonald, Chief Procurement Officer for Department of Health.
Troy Jones, not Roy, Troy Jones, Administrator.
Right.
Lori Montgomery, Administrator, Transit Veterans Home.
Marie Castillo, Department of Health Officer and Secretary.
Pamela Bromer, Administrative Assistant, Office of Facilities Management. Shawnee Hartley, Administrator, Turquoise.
Jose Garola, Medical Staff.
Jeff Esquivel, IT.
Kurt Halistad, Sequoia, Administrator.
Which Lawrence, Department of Veteran Services.
Oops. I
Jack
get to
Fox,
see him.
Cabinet Secretary, Department of Veteran Services.
Hi, morning.
Michael Ortiz, I'm a member of the public.
Ted Galvin from the Legislative Finance Committee.
Ryan Hoffmeister with the Legislative Finance Committee.
Eric Chenier, also with the LLC.
Daphne Ray Hopkins, Behavioral Health Director for Children and Families Department.
John Calabas, Administrator of Los Lunas.
Blair Tidmore, Office of the General Counsel for Department of Health.
Bill Shelfie, Chief Nursing Officer, Department of Health.
Jeremy Amarella, Chief Facilities Officer for the Department of Health.
Okay, thanks very much. We've established a quorum. Quickly, we'll go through a couple items and then get to the business reports. Real quick item is just the approval of the agenda. So I'll ask for a motion to approve the agenda.
So moved.
Okay, second?
Second.
Okay, all in favor? Yes.
Aye.
Do you have any extra copies?
We might, I'm not sure. Pamela, do you have any extra copies?
Just handed out the last one.
It's okay.
Oh, okay. Oh, there you
How many
go.
more do you need? You need some made.
Our budget's been cut.
Okay.
You more copies?
All right. Well, I think we're unanimously approving the agenda. That takes a few minutes. I wanted to, next item is the approval of the minutes of the previous meetings. And you'll see behind here from April, the April packet that Pamela put in here, did a lot of work. And those of you who were at that meeting in April, on April 16th, you can take a look at all that. Includes all the administrative reports from April and the financial report and the credentialing report. So quite a few pages. I think the last page will be the credentialing report, so looks like it's about 25 pages there from the last meeting. So it also includes from April, well, everything from the April meeting. So I know that's not easy to read all that now, but I guess those who were there, if you see anything that doesn't look correct, let us know. So I'm going to ask for a motion to approve the minutes of the previous meetings.
Move to approve minutes.
Second.
Okay, all in favor?
Aye.
Opposed? Okay, that passes unanimously, thank you. And now we'll go into the new business reports, and we always start with the Cabinet Secretary report from Secretary Ward.
Well, good morning, and thank you all for being here. And Troy, thank you for hosting us at DHI. We always enjoy being here. FY15 was a difficult year for everybody, and I want to tell you how much I appreciate the efforts that you put into improving not only the service that we provide to our clients, but also trying to improve our financial picture. We've done a lot of work, we've made a lot of improvements, and I'm very grateful for the efforts, not only from the facilities staff, but from the ASD staff as well. I know you put in a lot of time, and I'm very grateful for your efforts. We've made a lot of progress. And I also want to recognize Lori Montgomery, who is leaving the Veterans Home after more than 23 years.
That's good.
And we have a plaque for you.
That's good, Bill.
Let's give her a round of applause.
I don't like goodbyes. No, it's not goodbye. That's all the business that I have for today. Thank you.
Sure. And now we're going to do the facility administrator reports, and I wonder why we always start with Troy, so I'm not sure if it's got a page number here, but right after the credentialing report dated April the 9th, the next page after that's going to be an administrator's report, but it's dated today's date, Thursday, July 16th. So I don't know if everybody can find that. Does everybody know where that is? Do you have that? Okay. All right. Well, thank you, Troy. Will you go ahead and give your report?
Once again, I'd like to just tell everyone thank you for coming. Welcome to NMDOH. It's great to always have people come in and look at the best kept secret in New Mexico and to be our facility and the wonderful work that we do here. I want to make one quick just comment in regards to Lauren Montgomery. I mean, it's sad to see her go. She was actually, I see her as the veteran of administrators, not only the veterans administrator, but she's our veteran administrator, and she was my mentor, guide, and the person I could go to when I needed help. And so I appreciate your mentoring me when things would get rough down here, and thanks for all your support. All right, so we'll go into, if you're, it actually does say page 1 here on the report. We just covered the census first. And for some new people here, we actually have 5 divisions that we have in our facility. First one, there's the adult psychiatric division. We actually had 210 admissions, 202 discharges. We ran an average census of about 76. Our adolescent unit, which is the care unit, is adolescent sex offender unit. We had 3 admissions, 3 discharges, and we were averaging 10 out of a capacity of 12. Our forensic division, we had 18 admissions, 13 discharges, and our average daily census was 46. The 1.5 years, the individuals that have been found not competent, not restorable, yet dangerous, they can be put with us for what would have been the maximum duration of their sentence had they been found guilty and gone through the court process. So our adjudication, we have people from 3 years to multiple lifetimes that are going to be with us. That average was 35. Our outpatient program is called community-based services. We had 101 admissions. We're running about 1,188. And in our nursing home, we had 13 admissions, 17 discharges, and we averaged a census of 146. The projects and constructions, one of the things that we're really excited about, we had the governor come out last week and informed everyone that during the special session, we were given $16 million to complete phase 3. There's going to be a little bit more money needed for that, but it sounds like everyone's on board with making that happen. That would be great, so we could then move all of our residents into one building. Before that can happen, we also need the demolition of our old meadows. That RFP, I was just told yesterday, is going to go out on the street July 23rd, so just right around the corner here. We're expecting sometime in the middle of September to begin the demolition, and it's going to take 150 days to get that demolished. After that, we're hoping that everything's just going to flow right in with the phase 3 development and construction. So it's actually going to be really good timing for this to all take place. What's that?
Congratulations.
Oh, thank you. Congratulations for all of our residents in New Mexico. That's wonderful. We had, if you remember from the last governing body meeting, we had to do a declaration of emergency on an individual driving through our front doors over here at the admissions building at 2 a.m. And we got, those are actually in place now, not quite completed, so I'm hoping by the end of this week they're actually finalized. We did also have an emergency declaration at the last governing body meeting to GSD regarding mold remediation. We had leaks in our roofs at forensics. As a result of those leaks, mold was identified. We had to close down an entire wing of 20 beds, move those very secure patients into another secure area, which ended up being into where our STOP program is. We run a 6-month program over there of 8 people. Those individuals were all being discharged. We put a moratorium on admissions, moved that secure population over, and are waiting for the remediation and restoration to be done in that C wing, is what we call it in the forensics main. Gets a little nervous whenever you take a very secure population and have to move them somewhere and be separated from the forensic main, which is used to that. But so far, knock on wood, we've done well. We actually restarted. We had a meeting yesterday regarding our cottages. We had received funding from the LFC for capital fundings to do our HVAC and roof replacements on our cottages. We started 2 of those. When they found mold in there, got to the point where, metal beams were actually eaten through. There had not been patients or staff in those buildings because we knew there was mold. But when they found that, the cost to go through that has actually been pretty enormous. So we're, instead of 6 cottages, I think we're going to end up maybe with 3 or 4 that will get to be redone so that it can inhabit patients again. On the next page, we want to just personnel, just a quickie. We did 23 hires this quarter. We had several individuals. One individual that retired, one of our primary care physicians, one of our psychiatrists has been with us for quite a while, is going to retire at the end of this month. We were fortunate to take one of our neurologists that we had in town. We hired her, Dr. Designate. She is now our chief medical officer and our medical director of our nursing home. We have informally made an offer to Dr. Vacancy as our chief of psychiatry. Waiting on the paperwork to be finalized, and he's going to come on board as our chief of psychiatry, which is great. And Shawnee Buff is our long-term care administrator. She resigned to go work for licensing, Department of Health Improvement. We're fortunate to have Bill Schulter, who's been with us before. He's hung his license on the wall and taken care of our nursing home for us until we hire another one. Just some miscellaneous stuff here. We have CMS is due anytime. In fact, we thought they would have already been here, so we're just waiting with, we're not holding our breath because we pass out, but we're waiting to show up. Our adolescent sex offender program went through their CYFD survey. We had nothing found in the physical environment, life safety, or personnel, and the training files was all perfect. We did have a few areas in regards to treatment planning and some documentation that we wanted to see improvements on, so we've submitted that corrective action and they accepted it. We also had a meeting with the LFC last week, and we got to meet Eric. They came in with, was it 3 analysts, the director of LFC, Director Abby, and Senator Campos. I think that was a great opportunity for us to be able to educate and explain what we do and how the facility operates and how complex it is. And I think it was a very successful and productive meeting, and I think we got a lot of questions answered, and sounds like a lot of support from LSC for next fiscal year, so I was very happy about that.
That's right.
I'll stand for questions, Mr. McGrath.
Sure. Well, any questions? I guess Troy told them everything they know. You need to know, so that's great. Thank you very much. We're going to do Sequoia next. Carmela, would you like to give your report?
Sure. Start with our census. This is our average census for April, May, and June, and our current census being 31. Our projects that we recently completed was we had to declare also an emergency on 2 of our air handler units for our education and administration wings of Sequoia. They were replaced. And we're also in the future going to be requesting for the other 2 air handlers in the gym and the kitchen area. Those would be the last two to complete the, for full replacement of all air handlers. We also completed 2 of the 4 lodges on our remodel and changing the environment for a softer therapeutic look. We replaced all the furniture at our facility in the living quarters, not the bedrooms, but in the living area of our 4 lodges. Our future projects, again, are to replace the old locks and doors that have become worn and non-functional, the 2 remaining air handlers, the phase 2 of our electronic access system, and then we want to do a secondary road for emergency and our parking lot replacement. For human resources, we have currently 18 vacancies, 18 positions that are vacant with an 18% vacancy rate. We've been successful in hiring an RN. We have 2 vacant RN positions. We've hired a behavioral health therapist and some mental techs and some supervisors. Our principal for our education have a mid and high school at our facility, which is its own district, and we have a principal who has recently retired. We have been successful on hiring a principal, and we're in the process of hiring 2 more teachers. We do share our education program with Turquoise, and we've just completed a successful year in providing education services for Turquoise Lodge as well. We have 4 classrooms at Sequoia, and then we have 1 full-time teacher at Turquoise Lodge. So that's been a huge success for Sequoia and Turquoise together working collaboratively. We also closed our fiscal year in a positive overview. The facility overview, we had our biannual survey from the Environment Department and had 0 deficiencies in our kitchen area. We go through that survey twice a year. We also had our licensing and certification survey in March, in which we received full licensure and certification for 18 months. In my career with DOH, I've not ever seen a facility get 18-month certification, so I'm quite proud of that at our facility. We got an 18-month certification, so yes, I'm very proud. It's been a lot of work for Sequoia in that area. We're actively working with the task force and working collaboratively with Turquoise in the areas of education, psychiatry, psychology, and training. We also provide training for Turquoise, and we're actively consolidating or looking to consolidate our food service programs with Turquoise. So streamlining services and saving a lot of money between the 2 facilities. Sequoia also has done a great job on reducing restraints at our facility, and we do not use mechanical restraints and have not done that in over 2 years going now, and have not had any seclusions. Our holds are physical holds, and in the last month we had only 6 physical holds, and they were all to separate physical fights between 2 residents, nothing behavioral or such.
Yeah, and I'd like to comment on that too. We go back 12 months. I mean, it's really been a tremendous turnaround there. We had a very small census last July, and now we're all the way up to 31. And the financials a year ago were about $1 million deficit, so now you're at a very positive number. So that's about it's a huge turnaround, $1.5 million turnaround. So that's incredible, and we're providing really great care there. So you've had a great year.
You know, Brad, I think also programmatically a lot of growth and stability has happened over the last probably 2 years.
Right.
So you don't want to make light of that either, because it's really difficult to make that kind of program change, and congratulate you for that. Thank you.
Right. That was a big change going to this therapeutic model with reducing the restraints and seclusion and chemical restraints. All those things are all gone now. So we just need to keep working with you to do renovations there.
Right.
So it looks less sterile looking.
You're correct. It's been a 2-year process, and to change a culture it takes some time. So a lot of training. We've been investing in a lot of training. And we don't do training every year. We do it every 6 months to make sure that the new program sustain some of the changes that we've tried to make. So constantly training at our facilities.
Okay. Any other questions for Carmela? Yes, Pam?
I'm not sure if this is for CYFD or for you, but as a result of the changes that you've made and your stellar certification for the is CYFD now doing admissions to the unit, to Sequoia? Because when we visited, you weren't receiving very many from CYFD referrals.
Well, we weren't receiving them for any particular reason. I mean, if they didn't stop sending referrals, and you're referring to like YDBC referrals?
No, at the time we were told CYFD, that's why I was curious.
Oh,
I can tell you, Pam, I personally made a referral to Sequoia on a young man who really needed that level of care. And Sequoia really helps us out when we have children that are violent. I don't mean to be disrespectful to them, but they have trouble controlling themselves, and they need a higher level of care than what we can get in a standard accredited RTC. Sequoia really plays a special role. So I can't speak for the entire department. I know I personally made a referral, and I'm happy to check into that, but we rely on Sequoia because it is the only facility that can accept this level of care. And we had some difficulties, but over the last 2 years, they've been worked out. And full certification means a lot. The ladies that work for me are really picky about things. So I would feel very confident with that they are in significant compliance with our regulations. And the CMS regulations around seclusion and restraint, which were some of the biggest issues that we've had in the last couple of years. We have to have a full and vibrant Sequoia because that's the only level of care that we have for our boys. We have a very small access for girls at the Redwood unit at Desert Hills, but we subsidize their rate quite a bit. So to keep that level of care for children that have very high needs is difficult for us.
And I only asked the question because I think they're also a treasured facility. And when we were there, I guess we misunderstood that CYFD referrals were down. It was also what we collected from the information. So I'm glad to hear your perspective of that because I'm amazed. I don't know that in my entire career, which I'm, only like 2 years.
Yeah.
I've seen such a facility.
Yeah, it's been a total transformation there, so it's really exciting. And I think some of the boys, right? Carmel, when some of the boys have left there, I think they had some hope, didn't they, that they were going to have a good outcome?
We have we actually had a recent really success story. We had a resident graduate from our school, and then another resident who called back to our facility who graduated from Job Corps and also received his licensure as an EMS. And he called back and let us know he's joining the Army, will be October 30th. And he was one of our toughest residents, and he just called back very recently, I think within 2 weeks, and spoke to the psychologist and wanted to share his good news.
Job Corps is really hard to get into, and it's really hard to graduate.
And he got in through Sequoia. We really supported him in that role and getting admitted, and he did get admitted or accepted to Job Corps and graduated. So he got some certifications in this short amount of time, 6 months, and he's actually joined the Army. He keeps in contact with us all the time, and he was one of our toughest residents. So those are really great stories to hear.
Okay, great. Thank you very much, Carmela. And, Turquoise Lodge Hospital is another great story. Shawnee got a beautiful looking report here. I wish everybody had one. It looks so nice,
We're saving money. We stopped at the color print.
This is quite a beautiful report.
That's 87%. Thank you.
So, our average census for our adult program for the last 3 months is about 29.7% or 29.7 on any given day, which is 87.3% occupancy. Just a side note, we actually receive between 80 and 120 calls a day for services here at Turquoise Lodge. That primarily being adults. This is a really tough population for them to actually show up and go through the admission process. And so 87% is a really good occupancy rate for our adult population. The average daily census for our adolescent unit is 7.1 on any given day. We have probably improved relationships with multiple systems over the last 3 months. This is also a tough population to come into our facility as well because unlike Sequoia, these are kids who actually have never had any kind of mental health intervention at times. And the thought of families and for kids to actually go into a facility for 30 days and reside there and not have technology and not have a cell phone and not have access to those types of things is a pretty big leap. So we are doing better in reaching out to the community, and I'll talk a little bit more about that in the narrative part. We have our demographics, which are very beautiful. We are servicing pretty much the same age range between 21 and about 40. Since I've been the administrator at the hospital, we continue to provide most services for people who are opiate and alcohol dependent. We are seeing a bigger trend in individuals actually using both. When I first started, I would say that either you kind of fell in each category, but we're starting to see a lot of polysubstance use in the last couple of months.
Sean, I can't, well, my eyes are bad, but in your pie chart one, the green and the blue, I can't,
The opiate.
opiate is the green?
Is green and the alcohol is blue.
Alcohol is blue, okay. Well, that's most of it then, isn't it, those two?
On the next page, we have the counties that we're servicing. We pretty much service the majority of our consumers come from Bernalillo County. And that's been pretty consistent over the last year or so. But as you can see that we're actually servicing almost every county in New Mexico, with very few unhighlighted. In the last governing board report, we highlighted our MOTU program. So we have actually made significant changes with that program. MOTU is a program where people can actually have the opportunity to do social detox in New Mexico, and it's a county-run program. So they actually have 60 beds. People can come in who choose not to actually want to be in a hospital setting. So they come into their program, they're admitted into their service, and we run the urgent care that actually services the consumer. So we have a nurse and a nurse tech and a mid-level provider who actually sees every single person who comes through their program, and then we actually prescribe the social detox medication. When I first started, these folks were just kind of coming in one time. Their average stay for MOTU, or for MATS rather, was actually 1 day. In the last 3 months, we actually started a new process where every single consumer comes into the program and they're actually reevaluated for the first 72 hours of care, which has really improved the quality of care that we're providing with them. Medications are reviewed, and so the consumers aren't necessarily getting an opiate or an alcohol regime. The medications are really being custom made for that consumer. And we actually moved to what's called daily dosing, which means that we're not giving the medications to the county to administer for a week, which at times, sometimes the consumers were actually leaving with those medications, which was problematic. And so now we're actually dosing those consumers on any given day. As you can see, the visits have actually doubled, and their length of stay has actually increased. I'm starting to hear more feedback from the different systems that we interact with that people who used to come to MATS over and over, they call them frequent flyers, that they're actually coming back less because they're staying in their program longer, and they're actually truly detoxing and not coming back for another stay. So that this system, we've made great improvements, and the data reflects that.
All right.
Shawnee, can I ask you a question about the MOTU?
Sure.
Do we use naltrexone in this unit?
We do. We do.
Are you having success with that? What are your thoughts on it? Yeah.
We are. It's consistent with, I think, that report that Kenny had put out. We are also utilizing less opiate replacement medications, which is actually good. We're using the Rudolph medication model, and that has actually been better because what we also see in our hospital is that people are coming back to actually detox from Subutex. So these opiate replacement medications, they might be good, but we're also seeing that the consumers are actually needing to detox from that later on. So
Greg Rudolph led the way in chemical dependency at the University of Washington in Seattle, and his protocol involves the treatment of opiate withdrawal without the use of other narcotics. So it's not methadone, it's not Subutex or buprenorphine. So the people truly, when they get to the end of the protocol, are treated appropriately. And actually, according to his study, the patients actually feel better on this protocol, and then they don't have to detox from a second opiate. So it's kind of our own internal study, but a lot of people have started using this because it leads to better outcomes.
And during this quarter, myself and my two clinical directors for my adult and my adolescent program met with Serenity Mesa team. I don't know if you guys are familiar with them, but they are the organization where it was the heroin awareness team of people who had started this program, and so they created a transitional living program for 14 to 21-year-olds in the old Del Valle building that was owned by Hogatis. And so we've actually teamed with them in the sense that in the event that any of their youth who go into their program actually relapse while they're in this transitional living program, we're going to start fast tracking them back into our hospital for detox. So we're going to be actually participating in their program, ensuring that their consumers are getting the treatment that they need and actually not being kicked out of the transitional living program, because that oftentimes is what happens. We also met with the Department of Health. We're teaming with the Southeast Heights Public Health Office. They're going to be coming in and actually providing vaccines for our youth who are attending our school. And they're also going to be, starting in August, they're going to start doing an educational group with both of our populations around family planning, sexually transmitted disease, and harm reduction. We have also been exploring the diversified programming of intensive outpatient services at our facility. So we are in the process of actually going through some type of construction so that we can accommodate a larger group size in our military program. Jose has also given us all the information around the application and the policy and procedures. And so probably in the next 90 days, we'll be actually starting an intensive outpatient program for only adults.
Maybe, Sean, we're doing that. You're real knowledgeable about that. I know you've done that in the past. Can you explain to everybody how an intensive outpatient program works?
So an intensive outpatient program is a lower level of care than our social rehabilitation program. It will run 3 days a week, 9 hours of programming. It'll be facilitated by an independently licensed clinician. And we're going to be using the matrix model, which is a specific model for recovery. And I think the nice piece for us at Turquoise is that we can actually, all the consumers who are calling every day who don't meet the level of care of social rehabilitation can actually be funneled into our intensive outpatient programming, so we're not referring them out anymore. And the individuals who are in our social rehabilitation program will actually be able to step down into a lesser restrictive program. So they'll be provided with the 9 hours of group programming. And really, truly, when you think about recovery, it actually happens when the consumer leaves the hospital, because that's when they're really tempted and life is real. And they're going to have to be dealing with their recovery while they're in our program. We're looking at doing transportation as well, so I'm looking into that process so that we can ensure our shows. But, you know, intensive outpatient is a really, really good program, I think, for folks. And it's a real environment, which sometimes the hospital is an artificial one.
Right.
And it's not true.
The biggest barrier to intensive outpatient is the transportation, getting people to have the transportation to get there, so that's perfect that you're looking at that. Good job, Sean.
Right.
Our adolescent program actually teamed with an artist in the last quarter. Her name is Ophelia Adela, and she's an amazing ceramic muralist in Santa Fe. In addition to being an amazing oil painter, the kids actually did this for 1 month, and this was a really big undertaking because we teamed with Warehouse 508. I don't know if you guys are familiar with them, but they do some really great art with kids in Albuquerque. So we teamed with the artist for 1 month. We took the kids over to a gallery, and they actually created, I have another colorful pictures that I'll be passing around.
Very good.
This beautiful fish. And it's all made out of recycled stuff. It's about 7 feet wide, and it's actually hanging at the Botanical Gardens, and it's going to hang there for the next 3 years.
That's awesome.
I know.
Yeah.
At the Botanical Gardens. Wow. So it's going to actually be there for the next 3 years. All of the gills are made out of bottled out of recycled bottles. And we kind of did a recovery spin on it because all the kids actually put little notes about their own recovery and their substance abuse inside of it.
That is so cool. So after the 3 years, will you get to display it at Turquoise?
They're gonna decide what they're gonna do with it. But we were really proud of that. And it's really colorful.
Obviously. That's what I start. That's why it's colorful.
We also, in the last quarter, we created a readiness for change assessment for a detox program. And that's important because when people come into our detox program, they're only there for 3 to 5 days.
Yes.
And so what we're doing now within 24 hours is we're sitting down with the consumer. It's all ASAM driven. We're sitting down with them and talking with them about the
Nice.
program and whether they want to be a participant in the social rehabilitation program, and truly screening
Wow.
the person who's going into the next level of care. Since we've actually done that,
Cool.
we've had less AMAs, we've had less people have issues with the rules or the regulations of our social rehabilitation program, and our programming has improved tremendously. Lastly, our HIM department has also created a new tool for ensuring that all the documentation for our different disciplines are being done on a timely basis. We've done that with
Oh,
medical
really?
nursing, clinical, and
Oh.
nutrition. And since that,
That's amazing, isn't it?
our compliance with our documentation has improved tremendously. In the last quarter, we have hired 7 staff, an executive secretary, a financial specialist A, 1 behavioral health therapist, 1 medical records O, a registered nurse, a psych tech, and a rec therapist. And then on the bottom, there's the posted positions that I continue to have.
And I think, Sean, that's great too. I know right now you're in the final stages of selecting, I guess, a director of nursing and I guess an HR person as well, right? And finance.
We have done interviews for the finance director and the director of clinical services. And that director of clinical services is a pretty key position in our program because they're going to be overseeing both of the adult and the adolescent inpatient programs in addition to facilitating the IOP program.
Right. And the other thing, I know Dr. Dorman was helpful with that, but we've created a pharmacy supervisor position and also a couple pharmacy techs.
Mm-hmm.
And that's going to help you by having employed people there. Both you and I guess Carmel, that'll help you as well. We have a contract right now, so by reducing contract costs, and the pharmacist you're talking to is really good, somebody I used to work with, so I think that person will be great. So that's another thing where you're partnering with I know you and Carmel partner on a lot of things, which is great, so it looks like we've got somebody for that too.
This candidate, she's also a pharmacist clinician.
Right.
And she'll be able to help on
That's
the
amazing.
therapy side, which is amazing. So
She's
the
very good.
request did come through and
Yes,
it's done.
they're ready to go.
Yep.
So any questions for Shauna?
I just have a quick comment, Sean.
Sure.
I just want to make sure you know that the Albuquerque Communities of Care team for Mental Health Awareness Month in May, they do an art contest. So if you guys would be interested in participating in that, Chris Morris is the chair of that committee with Open Skies, but it's really cool. And then this year for the planners, the winner from the Taos Youth Art winner, we're using that for the cover of our planner.
Oh, nice.
So they're actually kind of getting published. So if you guys are interested, or if Sequoia is interested, if they're interested in art, it's really amazing, the products that they do. And if you don't know how to get a hold of Chris, let me know, but I'm sure you probably do.
Okay.
Okay. And I know Shawnee Buff had a really good financial year. You've really turned around that facility, but in doing so, you've had a really good bottom line as well. So that's hard to do, but congratulations on that too.
Thank you.
Sure. And the next one, John, the Los Lunas Community Program Administrator's report.
Thank you, Brad.
Sure.
Just related to census with Los Lunas, presently we stand at 80. Of that, roughly about 80% are in 24-hour care of that number. And within that 80 is right at 41 are Jackson consumers involved with the overall Jackson litigation. projects going on at Los Lunas at the present time are completed. We have partnered with the city of Belen there in Valencia County for access and use of the Eagle Park Community Center. We will open that up not just for programmatic and activity areas for the clientele or consumers that we work with, but also to other agencies that provide service to similar population, but also the general public. So classes that are offered are open to everyone. That's our attempt for really to start to be ingrained into that community in Valencia County and within the city of Belen itself too. So we see that as a real positive step for our consumers, but also for Valencia County itself. It's a real step forward. We're also pleased to announce that Alicia Grady, Dr. Alicia Grady, has accepted a position as dentist in our dental clinic. That'll take us up to basically 2 full-time dentists. That gets us away and back to the normal rotation, and this dental clinic serves on a statewide basis individuals with developmental disabilities, so usually the more severe cases. This allows us to get back into 6-month checks basically and get back into regular rotation of existing clientele, but also to impact the waiting list to eliminate that. So very large plus related not only to those involved with the dental needs, but also related to Jackson litigation and the lawsuit itself. Impacts that in a very positive way related to Los Lunas. The related to accreditation or CARF accreditation between finances and some recommendations that were made to us out of our pre-survey in terms of enhancing a couple of our programs, mostly related to rehabilitation and employment type of programs. We requested a couple of reclasses to upgrade some position to put basically more oomph and emphasis on those programs. Well, those have cleared SPO at present, and I believe are ready or should be being posted for hire. So that gets us into the formal sequence now that we can show a track record related to accreditation for any areas that we may have been deficit in, but also allows us to free up the funds available that match up with the accreditation fees in those parts. So we're actively going through that process to get ourselves a date for that accreditation to come. We expect 3 surveyors for probably 3 to 4 days related to us. One difference on accreditation, since Los Lunas was accredited at one time in the mid-2000s, but it dropped that accreditation. We go in as a new provider basically with a clean slate. So that would mean that every single program and every single property that we lease and every residence are reviewed rather than just a percentage. So it's very much more formal review than you would get, I feel, at least the ones I've been through, as an existing accredited body. So working through on that. We have also been, within the last month, related to Jackson, assigned the task of cataloging all records related to Jackson that are still located on the old Los Lunas Training Center campus. We're starting to have put our team together that's going to address that process. A huge undertaking, as we have documents basically from back in the closure in the early 80s that we'll be going back through, but we have initiated that process. The property we identified as a second intermediate care facility, basically for females, and via court referrals, basically. We had a issue with one of our other residents in one of our total care medical houses that forced a move from there and a remodel that needs to be made. So we're accessing that second ICF property for those consumers at present time until we can get our existing property back online, make the move back, and then we can push forward on the ICF for the second ICF development within Los Aquatic Center, our therapy pools are due to some recalls on some inline filters and the need to replace water softeners. That will be closed here shortly for roughly about a 4-week period. I note that that is not just for our consumers and their therapy needs, but also it serves Valencia County as the only therapeutic facility or aquatic program for those that have medical needs and medical sign-offs for physicians for aquatic activity. So we hesitate very much to do a total closure, but we're getting forced into that situation. So that will be occurring probably over about the next month. Hopefully we can minimize it to 2 weeks. We're working with Michael Brown's office, maybe a bit longer, but we'll get that up and going as soon as we can. Facility newsletter is due out. We thought it would be out this month, but we're working with Office of General Counsel on some media releases, etc., that we want to make sure we have all the clearances on that before photos and such of individuals that are involved with us or their families or leaders. So that's on hold for just a bit until we work through that. We're also working with DDSD, Developmental Disability Supports Division, to identify a funding stream related to court referrals or crisis referrals, statewide basis, that come into us that on an unfunded basis that usually are very labor intensive, staffing intensive, high cost issues that we are attempting to get a funding stream to match up with that, so we continue that work. And progress is being made from my conversation with DDSD yesterday. So I felt good about that. Our number of our residences that we lease within Valencia County, took a look back a few years back to FY12 to see where we stood, the number of residences leased. We were at 20 at that point in time. Now, as we talk today, or as I speak today, we're at 28, looking at potentially at 29. So quite a bit of growth there in the last couple of years. We did undergo Social Security audit related to all our consumer funds. We had really no recommendations there, and they found all was in order, and that was, let's see, right at 30 days ago, and that was completed. We do anticipate a second round happening probably over the next 2-month period or so related to Jackson community practice audits. And we expect to have anywhere from about 50% of our Jackson consumers audited. That's basically a week-long audit outcome related to the services program that they receive. Our comparison to our FY14 versus what we saw closing out FY15 on our overtime was down about $130,000 from the previous year. Related to personnel for us, we've had 4 new employee sessions over the last quarter. That consists of about 10 or 12 trainings that they have to go through over a 2-week period. So really when I say 4-week new employee orientations, one ends, another starts basically, as we're working through those. Our hires of note, I noted Dr. Grady with the dental clinic. We've also had some successes on the nursing front with the RN supervisor hired, also 1 RN and 2 LPNs. As of July 2nd, our HR identified our vacancy rate at 6.8%. The positions, I noted that we were trying to get through reclass to allow us to push through on the accreditation issue, have cleared SPO, and we're in process there. So a lot going on, some things completed, some right in the middle as we work through. Hopefully next governing board will have more formal dates or the possibility that we've already had the accredited body through our facility. So that's where we presently stand. Any questions, I would be happy to answer or get the answer. But thank you.
Sure.
Thank you.
And John, I know this year, you're starting out the year with a lot lower number of vacancies, so that's really a great way to start the year. And could you just explain a little bit about 1.6? You know, we got 1.5 with Troy, and you got 1.6, but that's just a short term for what you're getting there.
Yeah, ours are in same type of scenario that Dr. Jones had addressed for Las Vegas in terms of court-ordered referrals. Ours are just identified as 1.6 because they are related to individuals who have developmental disabilities, basically. And those are court-ordered referrals that we work with Office of General Counsel within Department of Health. Flip side is we can get statewide crisis situations that are really pretty similar but not titled officially 1.6s, so we deal with those groupings. So similar to Dr. Jones' program, however, ours are for sexual offenders, basically through coming out to us via court orders, and that's who we do. So that's that population.
Okay, great, thanks. Any questions for John? Okay, and Lori? There you go.
Okay, at the Veterans Home, you see our report in there where the census is fluctuating between 126 and 130. It's been, we've been up to 130 a couple times and it fluctuates up and down. We're getting a lot of referrals coming in. I've made a couple changes in the admission office, changing some personnel around to try to get a little bit more zealous and contacting some of the agencies around the state for admissions. We did have 19 admissions this last quarter, which is a lot for the facility. And of course, with long-term care, you can't really, census will go up one day and down the next, and so it's hard to predict. But our goal is to be at 130 for the rest of this fiscal year and going forward. The biggest project that we have going on at the facility is the new Alzheimer's and skilled facility that's being built. That is a 65% grant from the federal VA that we've had in place for a while. We've had the 35% match from the state started back in 2008. So that money has stayed intact for that project. It is a $24 million project for TRC. So it's going to be one of the biggest projects they've had since they built the high school or some of the other projects around. So it'll bring a lot of labor resources to the community. It's going to do some really good resources for the community for that. That project is 59 beds. It's 39 beds Alzheimer's. There are 3 13-bed houses. The VA adopted a different model several years ago, all private rooms, all private baths. So each home is all self-contained. It has some kitchen, own recreation facility, own laundry facilities. So they're truly little houses that are set in this building. Same way with the skilled beds. There's 2 10-bed houses that are attached to the new rehab facility and the new swimming pool. The swimming pool at the existing building has been down for a couple years. It's unrehabitable. We can't rebuild it. The building is way too old, so we put a new swimming pool in the new building, and it will be fed with the hot mineral water just like the old one. So we do have our well that's downtown that will continue to pipe up the hill and feed the new pool. We've had an aquatic therapy program with the community for many, many years, and we're hoping to get that back up if the new building is built and done. So we're very excited. We'd like to have everyone put on the groundbreaking on their schedule. It's July 21st, next Tuesday at 11 a.m. On the site. SUNT is the contractor that was chosen for that project. So everyone will be on site to kick that off. So we invite everybody to come down and join us for a nice afternoon. Under personnel, it continues to be a struggle to hire new individuals in Sierra County. As you can see, the numbers are relatively low, 281 for those months. It's just a hard population to try to recruit from. We continue to have job fairs. We had one last Saturday on July 11th. We did have 7 potential individuals come up and use the computers to apply for jobs. We've fed the community, we've fed the people that came, so trying to entice them to come onto the grounds and giving them something. We had a couple people that may result in some new employees. So we continue to work that very hard. Under survey and regulatory issues, we did have our CMS survey in the month of May. We were the trial facility for the new EPOC, the electronic plan of correction. I must say that it's an extremely easy project to be involved with. It's an easy process. Once you get the 2567 online, you can fill in the blanks now. You don't have to cut and paste. So those of you that have to do the plans or corrections for your facilities, you can look forward to that going forward.
That's good.
It is very easy. When you submit it, you do get a response right away, and they did clear the deficiencies within 2 days after we submitted the documentation. So all of that is done and cleared. We received no life safety deficiencies from CAS, and we also had a deficiency-free survey for the assisted living. So I'm extremely proud of the staff who worked extremely hard on all of those projects every day. They continue to work on those survey issues going forward to make sure that we're always in compliance. VA will be in the house in August 2015. They always come into your facility the month that you get certified, so you can always expect them. You don't know what day in August, but between the 1st and the 31st, they will be in the building. And Joint Commission will be back in the building for their triennial survey in September of 2016. There's just a few little announcements down there. The infection control plan has been submitted to the governing board for their annual approval. And I would stand for any questions.
Okay, thank you, Lori. Appreciate it. I guess I'll do the New Mexico Rehabilitation Center. That's Roswell. And Roswell's doing some really positive things now also. We've got a lot of numbers there, but what's on the next page, they've done a lot of recruiting down there. I've spent a lot of time there, and as of today, we're down to about 7 vacancies. So we've got almost all our vacancies filled there, especially in the nursing area. So a lot of success there. We have a new director of nursing who was on our night shift, but she's an acute care and former Army nurse. And she's going to be a great leader. She already is. And we have a new CDU director. CDU is what we call chemical dependency unit there, but it's really more, it's not medical at this point. It's more what we call the social rehab. We were reaccredited by the Joint Commission, so that went really well. And we're trying to do a lot of marketing we have the 2 sides there, the medical rehab side and the chemical dependency unit. So it's a smaller building. So staff are pretty much driving around the state. I know they were in Albuquerque yesterday going to UNM Hospital and Presbyterian. We're trying to just make people aware around the state who we are and where we are, and that we're another source for them when they need some rehab done. So the goal in Janie has here, the goal in the MRU is to average 10 patients a day, and that's relying on hospitals, especially orthopedic surgeons, giving us some referrals that we think we can do. So that census does go up and down. On the CDU side, we tend to average about 20 patients usually. What we're really doing, what we started there, we were the first one down in Roswell to start what Shawnee called an IOP. When the Arizona providers pulled out of Roswell on March 31, there were a lot of meetings going on at that time about how that could be picked up by other facilities. We're just doing a small part of that. La Casa down there is doing a lot more, but what we're doing is that 15 persons in a group, 3 hours a day, 3 times a week. We just got up to 15 this week, so I think in the next week or two, we'll be starting a second session on evenings from 5:30 to 8:30. There's plenty of business out there for that, unfortunately. But it's also very good for the revenue side, too. We worked through HSD. HSD's been great. And then they work with the feds, and they help us fast-track getting the program up and running. And they helped us with our fiscal agent and with the 4 MCOs. So we got amendments to the contract to do the IOP. So we're real excited about that, because if we have 2 groups, that's about $600,000 that can really change your bottom line. Well, Roswell had a surplus this year without that, but so we're starting that in 3 places. Fort Bayard, we'll be talking about that in a couple of minutes here. But so the Roswell facility is a smaller facility, but we are making a lot of improvements there. We've got a lot of nurses that came from the 2 acute care hospitals in Roswell, from Eastern and Lovelace. So we've really been lucky that we've got a lot of really skilled nurses. In August, we're hoping to open our 4-bed medical detox unit. So we are ready to take that next step down there and do a medical detox as well. So that's going to be a big improvement that we can offer there. So we'll work closely with Shauna's group on that. So a lot of positive things there. I guess that's it. Any questions about Roswell? Sure, go ahead.
Do you have any interest in adolescent IOP in Roswell? Because that's one of the services that were lost.
Right.
Children's services were pretty much decimated in that, and La Casa's
Right.
they're getting caught up, but
Getting
that's a
caught
lot
up.
to take on, because they did not have a history of providing children's services, but we would be super willing to work with you guys if you want to get certified for Medicaid IOP. The practice that adolescent programs uses 7 challenges.
Okay.
And it's super. It's SAMHSA approved. It's an NREP practice. But if you had any interest in adolescents, right now we are operating our own IOP within the juvenile probation office, but just hopefully until we could find an anchor in the community. We're probably about 100% Medicaid as well. If
Right.
you're
Yeah, maybe.
interested.
Can you talk with me more about that, Jeremy and I, so we could discuss that some more?
And it sounds like it also would be something to discuss with Turquoise Lodge, since you do have an adolescent population.
Right. What's your thoughts on that, Shauna?
Well, IOP is kind of saturated. There's a lot of IOP programs, but Roswell, we didn't see one to start up.
That would be awesome. We would love to partner with you on that.
Okay. Why don't we keep talking about that then? Good point. Thanks for bringing that up. Okay.
So Daphne, are you talking about 12 to 19-year-olds? What age group?
Well, the way Medicaid split it up, it's 12 to 17 and 18 plus, I
Okay.
believe. So around the time you turn 18, you are forced into the adult
Okay.
program. But I think we'd have lots of referrals.
Okay.
Yeah, sadly, there's plenty of business, unfortunately, out there.
And the court would be very pleased as well.
Okay.
Because we've had difficulty keeping their needs. And amazingly, 5 adolescent boys in Chavez County can really wreck it. It doesn't take a lot. It's not a high volume even, but our youth can get out there pretty fast.
Okay, great. Yeah, it's contributing at least, to something for the community. Thank you very much. We'll keep talking on that. That's great. Thank you. Okay. And then Fort Bayard Medical Center. Kathleen.
At Fort Bayard in the last 3 months, as you can see from the first page here, we did like 148 average daily census, 146, 145. We actually, the quarter before, got up to 152, which, as we call it, boiling the frog slowly.
Okay.
Because in the leadership team, we were talking about how we were going to get up to 150, and of course, they're used to doing 125, something like that. The world was going to end. And so I said, well, we won't talk about it. We won't say anything to them. We'll just keep admitting and we'll just move on.
That's good.
And so Village says to me, so you want to boil the frog slowly? And I said, what? And he said, so he's talking about that old joke. And I said, well, of course, if you put the frog in the hot water, it's going to jump out.
Right.
And so anyway, we just did that. And before they knew it, the admission team one day, they were at 152. And
Wow.
I said, I want to say anything, but you're at 152. And they go,
Wow.
and I was like, yes, okay. But basically, we're staying around 145 now, 152. In any nursing home, you always have a set point. It's regardless of whatever your license is.
Right.
And our set point is about there because it gets pretty interesting about that amount. So we're staying about that and moving on. We just punch all you want, we'll make more. That's our motto. And dietary, we've had some challenges in the last quarter because our floor was redone. In fact, you were supposed to be at my house today, not here. But with our construction on our floor, all our dietary had to come out of the school system. So it was quite an effort, and Cobra Consolidated Schools have been fantastic. They not only gave us their facility to work through, they gave us a couple of their employees for free, and also helped us. It's just, when it was coming up to this point, I was really considering retirement because I thought, oh, this is never going to work. And but it did. And next Thursday, we should be finished and back into our kitchen.
Great.
And I can't believe it because every surveying agency that was known to man came into our building during that time. We had a VA survey, and I'm talking to them, and I said, do you know about the kitchen? Because you don't want them to go in the kitchen and say, where is the kitchen? And they said, no. I said, oh, this is a good story. You're going to like this. So it was fine. Nobody cited us on any dietary. It was like, I can't believe this is happening. Actually got some news yesterday that no one lost weight. Of course, a couple people complained that we were starving them, but, you know, it was, no one lost weight. The employees definitely didn't, because we stopped employee meals during this time, and so everybody went to Wendy's, so I can imagine. So I'm kind of happy to get back the employee meals on Thursday. So that's what's going on with the kitchen. Our point-click care conversion is in the last stages with our financial and our billing. That's been real interesting as well. And I have a funny story about that. I started working with the face sheets. Now, to me, you have to have an engine to run your train. Well, in a nursing home, your face sheet is the engine that runs your train. So we were doing some stuff, so I started getting the last paperwork of admissions and putting it in PCC, and I was all very proud of myself. And then I'm talking to medical records, and they have a different face sheet. And I said, well, how come your face sheet doesn't look like my face sheet? And he says, well, that's our program. And I said, what do you mean our program? He says, yeah, we use our program. And I says, our program is not a name of a program. What is the name of your program? And he says, Excel. And I says, oh, so we could have saved like $1 million here. You know? So now they, you know, end of that story is they're using the PCC face sheet. So we have one face sheet going into our insurance. So, I mean, people don't like new things. That's the way it is. Our strategic plan has been completed and submitted. Our 5-year plan. We have teams that work on that. We don't meet as regularly as we did before because we've got it going, but we still meet, you know, to keep it up and going. Our vacancy, okay, drum roll, 8.9%. Our rate. And of course, it probably be different as I speak, but you know, it was 8.9 at printing. So we're very, very proud of that. We had 21 new hires during the quarter. We went to some job fairs, and then we actually had an open house of our own to try to get, you know, we're like everyone else, we have a hard time getting people to come to work and stay at work, you know. It's a challenge, always a challenge. But our job fair did pretty well. You know, we helped, you know, we fed them. Like, who was it that fed? Somebody fed. Okay. I'm like, yeah, that works. and that helps a lot. So we're doing things like that, trying to think outside of the box, you know. My thing is, does it cost money? If it doesn't cost money, do it. If it costs money, forget it. No. But that's kind of how we're doing. We had 43 employees recognized in the above and beyond. Which we do, which it's very nice. You know, it's I love it. At morning meeting, we always get to talk about the above and beyond. So it's a highlight of my day. We had, like I said, everybody that wanted to come in and see our kitchen. Yeah. So we had our CMS survey, did very well. Then we had our VA survey, did very well. I wanted to comment on the EPOC. We also had that. It is fantastic. From an administrator that started with actual cut and paste, where you cut with the scissors and you paste with the tape. And then, you know, and then I graduated to the cut and paste on a computer, and then I thought I had died, gone to heaven when I got to scan in my survey and actually write on it.
Right.
This is fantastic, and it gets responded to immediately. It's really cool. You can print it, and when you print it, it says POC not complete in a watermark all over it. But then when it's accepted, you can print it, and it's, you know, clean thing. So you'll like it. It's cool. Very cool.
Kathleen, can I ask you a quick question about the certified nurse aide classes? Are those taught on the campus there?
Yes.
And who teaches the classes?
We have our staff development. We have a nurse educator that teaches that. And then everybody adds to that. She teaches the basic course, and then every department head, you know, different departments go in there and teach certain parts of it.
So those nurse aides that come out of that program, are they less likely to leave than ones that are hired from outside?
No. But you know, there is something that we just tried this last time that I think is going to work out. Because we're challenged with staffing, we did a monitor class and got some people started. Well, then we had kind of a large class, like 13. So we put half of them on the floor as monitors, kept the others in the class, and then we'll just switch over. So the ones that are in the class right now, today, are the ones that were monitors for a couple months. So they already know what they're in, you know, what they're doing. I think that's gonna make a huge difference because they are already on the floor.
Right.
And so we're switching that and did a, you know, kind of split it. At least. But unfortunately, we're the only only class in the area.
Yeah.
And we don't pay as much as the other facilities. So they'll come in there and go. But we're hoping that putting them on the floor first they'll know that it's better. You know, there. So that's, I don't know how I'll keep you informed on how it works out.
Okay.
But
Sure.
we are also working on our joint commission, you know, for our first accreditation. And the financing, I've got two of my finance people here, one you stole and one that I got new. She can't go, you can't have her too, so don't even think about it.
Well, she's sitting next to Michael Stanton there.
So we definitely, you know, we need to keep one of these girls anyway. And you can read about that, and it's, wasn't pretty, but it wasn't terribly ugly, so we're
It was very pretty, you were in surplus.
Yeah, well, yeah, it's,
That's right.
That's pretty.
yeah, it is.
That's always
it is.
pretty.
Very
It's
pretty.
like I said, quench all you want, we make more, you know. But, and then Yucca Lodge, I'm very, very excited about the IOP program there. We have all our paperwork in,
That's right.
and we are going for an August start. We have several people going to the matrix training at the
Right.
beginning of August.
That'll be in Roswell.
Adina Yulin is our director there, and she has been in the state a long time, is very well connected, and we have gotten several referrals. And she keeps saying, wait, we're not ready yet. And they said, that's okay, put them in inpatient, then they can go to the outpatient. So, you know, we're very excited about that. And she keeps, I should say, about 11 to 12 clients in that at all times. It is a small area, you know, and everybody's pushed for space everywhere. And we're only really limited by our space. But they had a very exciting, last week, they took all the clients with some staff, volunteer staff as well, to camp. And, you know, they just, you know, she came to me and she says, I want to do this. And I'm like, okay, you know, I trust her. And she goes and does it. Then when they come back, I got an above and beyond. I actually got an above and beyond. And I'm like, what did I do? You know? And then all the clients wrote me letters. And I mean, they brought me to tears because one of the biggest things that they said was, we got to go and have fun without being high. And we didn't know we could do that.
Wow.
Plus, of course, there was other people camping out there, so they, you know, they were around, you know, triggers as they call it, and they were impressed that they could have fun and still be sober. So I thought, I did a good thing. I didn't know, but but I'm excited about that program. They do a good job back there.
One thing I'd like to just mention with regard to Joint Commission accreditation, our goal is to probably go through accreditation at the very early part of next year. Millage and I have been working with this. Fort Baird's in a unique situation. They're actually going to have to undergo 3 separate accreditation programs. One for the Nursing Care Center, which is the nursing home, one for the lab because they're performing moderately complex testing, and one because of IOP, which will actually be surveyed under the hospital standards. And as it is surveyed under the hospital standards, we're, oh, by the way, going to throw in Yucca Lodge, since it can be surveyed and certified also. So that's a huge amount of preparation to do. There are some structural overlays that are kind of unfamiliar under hospital accreditation. NMDOH, of course, is very familiar with it, but it may seem a little strange to nursing care centers to have this kind of a structure. We're already ahead of the game because we're already credentialing and privileging all the providers there, which is not technically required by the nursing home standards. It's done through human resources, but we escalated their quality up there, so that's already been done. But we'll be working with the hospital and Millage very closely. Joint Commission has already accepted our pre-application, opened their website to us, and so I just had a conference call with some old friends of mine who are still with the Joint Commission. And we're going to be working it out, so we'll keep you updated on how it's going, how our prep's going. I expect that there will probably be not a whole lot to do, just a lot of quality control around data. You have to have a 4-month track record, which of course we've got more than that, but that means IOP will have to have a 4-month track record. So if it opens in September, we're going to put it all together for first quarter of next year.
And Kathleen, I know we were talking earlier this morning outside, I'll have Lisa Lujan check on that next week, but right now it's at HSD, your IOP application. I read that, signed the cover letter
Yeah,
for
they
you.
had asked for a few things and they haven't
Yeah.
asked, like in 10 days now, they haven't asked for
That's
anything
pretty
else.
good.
So,
I think we'll just
sign.
knock on their door a little bit, we'll
That's
make a
right,
phone
yeah.
call over there. And I know Jose and Lisa Lujan, we've had a lot of help. We've had a lot of help in Roswell, and I think we're working together. We're going to have IOPs at least in 3 facilities now. We'll have to look into that adolescent idea. That's great. So I think you're going to get enough probably for 2 sessions,
Yes, that's what I'm planning.
a day and an evening one.
Right.
So the need is there. I think it was La Frontera. They left Las Cruces a couple months ago.
Yes.
So that whole region, Deming, Las Cruces, Silver City.
And we're getting a lot of referrals and we're excited.
That is great. And also, as Michael said, you had a very good year financially as well.
Nearly a $500,000 surplus, so that's to be commended, and I know how difficult it is to get there and how hard it was to.
That's right.
What hard work it took to get there, so congratulations on that.
And if I could, what we usually do is I'll ask for a motion to approve all the administrative reports in the aggregate.
I so move that
Okay,
we
second.
approve all of the administrative reports.
Thank you.
Second.
All in favor?
Aye.
Opposed? We haven't anybody opposed yet, but opposed. Okay, and the motion passes unanimously. What we do at this point in the program here, we switch to financials. Leonard's not with us today, but Michael, right after the Fort Bayard report,
Yes.
there's a 1-page report. Got a lot of numbers, but
It does. I just want to say that Leonard is working on 3 fiscal years. We all at ASD, all of us, are working on 3 fiscal years at once, closing 15, opening 16, planning the request for 17. So
it is a huge amount of work for everybody.
It is, and Leonard apologizes for not being able to be here and present this financial report, but I'm happy to do it for him. I hate to be the Debbie Downer of the day, because I've heard so many great things about everything you do, and I'm so pleased to have been invited here today to listen to all of your accomplishments. It's really impressive and helps us all to know the value of the work we're all doing. So unfortunately, I get to be the one to say that we did end the year in facilities management with a $2.2 million deficit. We had projected a $6.2 million deficit, but after a lot of very hard work from everybody, and with help from the governor and legislature, we got a $4 million supplemental, which brought this deficit down to 2.2, but overall will allow the department as a whole to end the year not in deficit. So that's good news. Of course, there are issues that we're all facing with regard to these financials. We did well in the other state funds, projecting a $77.9 million revenue there. It's hoped that we can, well, it's really essential, actually, that we increase that for next year. It's difficult to be in my position where I am forced to come to the bottom line and say, we need to just do better here.
Right.
And I know how hard you are all working, and that getting that $77.9 million was great. But in the next coming fiscal year, we need to do better. We also have, as you know, an issue with contract labor. Contract labor over the last several fiscal years, something that Leonard did ask me to discuss over 12, 13, 14, and 15 fiscals, 12, 13, 14, and 15. We went from 1.3 to 2.1 to 4.2 to 6.6, 6.7 in fiscal 15. So I know these are discussions that you're all having. I'm not seeing any smiling faces. I'm sorry to report, but that is something that we need to work on. We were asked to do these projections by DFA for 15. That's what you see in front of you. Each facility created their own. Thankfully, we got that $4.4 million surplus. We've also, as you know, done projections for 16, and we did those in a program called Smartsheet, which we're going to be discussing at this afternoon's meeting. Smartsheet is a collaboration software that's very much like Excel, but it's not Excel. It's like Excel in that it has columns and rows, but each row, as you know if you've worked with it, you can have a discussion, an ongoing discussion about that row. You can attach documents to that row to explain those numbers, and you can collaborate with as many people as you need to, and collaborators are free while a license costs something, very little really. Collaborators have worked together on our FY16 projections, and that helped us to understand what we need to look at in FY16, and we've just in the last week put together a FY17 scenario model that we'll be working with Retta and the deputies, and ultimately with you folks to see where we are for FY17 and how we want to present our budget request to the legislature on the 1st of September. 1st of September is the day, maybe it's the 2nd, sometimes Labor Day gets in the way. So if anyone has any questions, I'd be happy to try and address them.
I did want to mention, you've done great, as your team has. We've got a really strong team now, I think, in ASD. And Kim's coming on board. Why don't you, Kim, try to describe a little bit about what your job duties are going to be this fiscal year?
Well, just to let everyone know, I was at Fort Beard Medical Center, and this is my wonderful replacement. Great job. I feel good about Fort Beard because she's there and Kathleen's there. So it's kind of my baby, and I want to see it do well as all the other facilities. And my role is to make sure all the facilities are within budget, that we are operating efficiently, maximizing our revenue. And I'd really like to see us be more proactive in our spending and just planning for spending, rather than, I feel we're a little bit reactive at times. And some of that is unavoidable because rules change and sometimes we don't have enough time on the front end, but I'd like to get a handle on that. But for the most part, just managing expenses and staying within budget, and preparing or creating a dashboard that will help us manage better and see all of our indicators and statistics real time right now as things are going on. So I'm happy to be there.
Sure. Sure, go ahead.
And just to elaborate a little bit more on Kim's new role as the OFM Finance Director, when we've talked about the resource team with the facilities, this is another resource. So we all experience, I know we specifically kind of pull in vacancy rates and turnovers when we're talking about hiring new finance directors. We're hoping that this will also add someone to be able to be there, understand the facility's finances. In the event a facility does not have a finance director or needs help with their finance department, they have a resource that immediately can go into the facility and help assist them with that. And also keep that continuity so we don't have this kind of like stop and then suddenly have to ramp back up and catch up again. Because I know we've had a couple of those type of things occur over this particular past fiscal year with facilities. So we're hoping that additional resource will be invaluable to the teams. Also, and just beyond the financials, I mean, helping to do some analysis and giving some advice on potential decisions that would be critical to help improve efficiencies and where to spend the money for quality of care improvements. She'll be involved with projects, obviously, with the facilities, and will also be part of the contracting and the purchasing to help getting some of that stuff through. So if you guys are ever seeing there might be a sticky point or something that you need questions or help with assistance on that, she would certainly be a resource to help kind of push that through as being your liaison and voice in, wherever you say Santa Fe, so that you don't immediately have to send someone up there in person. She would be the face for you to help assist with that.
And also, I know, Michael, when we did those projections, a few weeks back, that we did our best. We had that all-day meeting in there. I think some of the facilities have actually done better than the numbers we had a couple of weeks ago. Like, for instance, Troy's come in a better number, and Sequoia's come in with a better number, Turquoise, Roswell. So I think actually, I don't know what the number would be today, but it's better than it was when we were doing the projection a few weeks back.
Right. I want to say one more thing about just Smartsheet in general. As Kathleen
Right.
said, people don't like new things.
No.
And while Smartsheet is a great new thing, and you can all check it out on smartsheet.com or in YouTube, watching some of the Smartsheet tutorials, it's going to have to be a little bit of a slower ramp up because there's been some pushback because people don't like new things, and it's a little bit of a transition, and that transition requires additional work, and sometimes that's not easy to have some younger folks understand that we need to do additional work now, but it's going to help us in the end. I think that it's sometimes difficult for people to see that, and I've heard countless times, if it's not broke, why fix it? Well, just because something's not broke doesn't mean it can't be improved. And that's my mantra, but I've been asked to just repeat it in my own head. Rather than say it as often as I was a couple of weeks ago. So bear with us, and I think we'll all benefit from advanced 21st century tools.
Yes.
I have made a career out of Excel, and Smartsheet is not Excel. It's like Excel. So I understand when people are embedded in Excel, not wanting to move to something that is not Excel. So I just wanted to voice that and tell you that it's certainly my hope that we move into tools that will assist us, but we have to do it in a way that doesn't upset the apple cart so much that apples become rotten.
Right. That'd be a good discussion this afternoon, too.
Indeed.
So, appreciate it. And also, at this point, Roy, do you want to introduce yourself, too?
Yes, thank you.
Sure.
So my name is Roy McDonald. I'm the new Chief Procurement Officer. I took over for Bernice, so I have shorter hair. But I look prettier. So my objective, though, is with the General Accounting Bureau's accounts payable and contracts and procurement, is to really make sure that we're doing things that adhere to the laws with the state of New Mexico and any federal requirements with grant funds that we might also be required to adhere to. So for my team, we're really looking at what you guys are doing and just making sure that we're adhering to those state laws. And certainly, Kim, you and I have already had some discussion about ways forward. And so we want to look at ways to improve the process without burdening the procurement process for you guys, because we understand the stuff still has to get done. So that's what I'm there for. I think we do have a good team there. We've got a little bit of turnover right now, so bear with us if payments are a little slow, or really it's in our AP section right now. So we're doing the best we can. We've got FY15 closing out here pretty quick. We're ramping up FY16, so it really is a good team, and we look forward to helping you guys do everything you can to support the patients of the consumers. The consumers throughout the state of Mexico.
We're really excited to have you here, Roy, so welcome aboard. I guess I'll ask for a motion to approve the Program Area 6 financial report.
Motion to approve. Second.
Okay, all in favor?
Aye.
Okay, opposed? Okay, passes unanimously. And that takes us, Dr. Dorman, to your part of it.
Okay, first thing on the order of business is the New Mexico State Veterans Home Infection Control Plan. This is a document that Joint Commission and CMS requires to be approved by the governing body. Mike Dimchak, who is the infection control preventionist at Veterans Home, has done this. He's had some assistance from Dave McCullough. Sorry, just blanked out. David McCullough. I think it's an exemplary plan. I think they've got all of their high points documented. They've got their goals set. and they've got some additional documentation at the back of that, something called an antibiogram, which is the sensitivity of bacteria in our community, so it will help providers if they have an infection that's initially diagnosed to be able to know which drug to initially treat the infection with. So I recommend that the governing body approve the New Mexico State Veterans Home Infection Control Plan.
I so move.
Okay, all in favor?
Aye.
Opposed? Okay, thank you, Dr. Dorman.
The second document is the credentialing report, and we need to discuss the credentialing report in executive session and reconvene for approval.
All right. Great, we'll do that. Any questions for Dr. Dorman? Okay. If not, gonna make a motion to adjourn to close executive session.
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? What we do now?